Accident-related injuries are the #1 killer of children. Yet there are few trauma centers in the country specially designed for their emergency needs. This story is not a recreation. It's the reality of life and death at Children's National Medical Center in Washington, D.C., a trauma center built just for kids.
No more shots, okay?
I don't want one of those again.
All right. No more shots. Kids are a little special. No more boo-boos, okay?
Is it gonna hurt?
No,
You won't feel a thing. You're not just treating a patient, you're treating a future.
Okay. Okay, little baby. Children's Lifeline, this is Kathy.
A call comes in from a small hospital 100 miles away. They're fighting to save the life of a 2-year-old boy, A.J. Winters, who was struck by a motorcycle.
This is Marty Eichelberger.
Dr. Marty Eichelberger, director of the trauma center, takes over.
He's got apparently an open fracture, open femur fracture on the right, and he's in a little papoose board, and he's open in his left eye. His pupil's fixed and dilated, but he's open in his eyes.
A.J. has suffered massive head and facial injuries, and his airway is blocked.
And they're going to trach him?
Oh, yeah.
The tube that was placed in the baby's airway was done under emergency conditions. The baby it doesn't breathe, and we don't provide oxygen to the baby, then the baby's going to die. It's as simple as that. You know, that thing is going to have to be secured because they pop out real easy, especially in a 2-year-old. So probably one of you just got to watch that trach all the way.
Within 20 minutes, the helicopter carrying A.J. arrives.
Okay, here we go. Lift. He's in the air. Good. Can we give him some... Has he got any volume?
Dr. George Panayotides heads the trauma team on duty.
AJ was paralyzed chemically by medicine when he came in because he was having a lot of pain. He was having difficulty tolerating the tracheostomy tube we put in him. He was moving around a lot. Somebody check the breath sounds, please. And we have correlation to the pulse ox.
We need a chest x-ray now, please. Chest x-ray.
Oh, he's got a large laceration on his forehead with a small depressed skull fracture.
Neurosurgeon William Smith examines A.J.
Here we go. It's there.
You need a gas mask check.
No, that's a globe.
Globe is disrupted.
Yeah, he has a ruptured globe on the right. His right eye was lacerated up front. The left eye was protruding and could not move.
Don't hyperventilate him quite as much, okay? Not quite as much. So it's worth getting his head scan first.
All right, the only question is whether that airway can be maintained without somebody holding it like that. And I don't think we could do that.
Nothing would do it all.
Marty, he's got this 3 endotracheal tube. It's sewn in. It's in too far. It's very difficult to move because how tight they tied it in. It's right by his carina. You pull it back and the sats improve, but if it slips back down, it ends up in his left main stem, and we get desaturation. I need a suture. I need something.
What kind of suture you want?
Like a 2 oat silk or
Reposition to needs to be pulled back a little.
So what we did was basically make sure that airway was safe for the baby. And then we made a decision that it was safe to take the baby to the x-ray department where we could get some information about how badly the baby's head was hurt, how bad the lungs were injured, and then whether or not he had any injuries in his abdomen.
He has multiple facial fractures and orbital rim fractures, probably with fractures of bone into the orbital canal in the globe itself. He also has, we see air inside the cranial cavity, which indicates that he has an open fracture communicating from the outside, so he has a high risk of infection.
A.J.'s parents finally arrive after driving 2 hours to the hospital. His father had not seen him since the accident. For 10 hours, a team of surgeons work on A.J., repairing injuries to his face and eyes, as well as a fractured leg.
Okay, can we have another retractor, please? Broad one, do you have anything broad with these? Hi, how are you doing today? Okay. Good.
The following day, Chief Surgical Resident Dr. Robert Attore brings A.J.'s parents up to date on his progress.
We're very encouraged how well he's waking up. His neurologic function is very, very encouraging, and we're hoping that his recovery continues to be as good as it has been so far. The other good news is that when the nurses took the bandages off of his eyes today, he was able to move the left eye over towards the nurse who was speaking to him, and that also is encouraging. We're not very optimistic about the right eye, as you know, as the ophthalmologist explained to you, but it is encouraging that he was able to move his eye in the direction of the nurse who was speaking to him. So he's made lots of good progress. Okay. And who I have here? You talk to your mom and dad? Huh? Sure. Yeah?
AJ. Hi, AJ.
What? It's all right. It's okay. It's okay.
AJ, Mama's right here. We here.
Okay.
We here. Put your leg back down, baby. Mama and Daddy right here. We right here beside you. It's okay. It's okay, baby.
What's up, boy?
The way he looked before he went into the operating room, he really looked bad. And after they brought him up and they let us see him, they did a good job. And I was really happy about what they done.
Good boy. We love you, okay? Shake your head. Shake your head.
Okay.
Shake your head, yeah.
Yeah.
Good boy. Good boy.
AJ, you try and get a nap now, all right? You need a lot of rest.
AJ, we be right back, okay? Okay?
We'll be right back, okay? Come on. What are your hand down?
Okay, we right here. We gonna stay right here. You want us to stay here with you? You want us to shake your head? Yeah. You want us to stay here? Okay, we right here. We be right here beside you.
The will of a child to get better, to do the things that are needed in order to fully recover is dependent upon the emotional support he receives. So the fact that his mother and father have been here with him from the very beginning, or at his bedside when he needs them, will have a significant impact on his ultimate prognosis.
Today, Anthony's doing fairly well. When we speak with him, he's able to follow complex commands, which is a good sign. That tells us that his motor centers are working, and also tells us that his higher cortical functions are relatively intact. AJ, can you stick your tongue out for me? AJ, let me see your tongue, buddy. Stick it out. Way out. Very good, AJ. Excellent. The other injury that we're involved with as far as the neurosurgeons is that he had a significant cerebral spinal fluid leaking from his nose. Given time, we would expect that leak to resolve on its own. AJ, wiggle your toes for me. It may take 8 months, 9 months, a year before we finally know what his final prognosis will be. There you go. Excellent.
We're doing the best we can do medically for these children. And we still have kids die every day. We might feel real good about AJ, but I think all of us are realistic in the sense that this afternoon, same situation, the child may not do as well.
Two months later, AJ has improved dramatically. He's regained most of the sight in his left eye, and with therapy, he's showing steady progress in recovering from his broken leg.
Come on, let's go in the playroom. Go ahead. This is definitely a miracle baby because the way he popped back, and I thank the doctors at Children's Hospital because I know if it wasn't for them, he would not be here.
We were able here, by the nature of our program, by the facilities that we have available at the hospital, to provide for AJ on the spot in the middle of the night 6 different teams of surgeons: general surgeons, neurosurgeons, ear, nose, and throat surgeons, plastic surgeons, orthopedic surgeons, and eye surgeons.
Got a pulse ox of 99.
Okay, buddy, open your eyes for me. Okay, hold on. Can I get a 4x4, please? It's very crucial to have trauma centers. As you see, obviously, in the case of AJ, that it does require a lot of money. Hospitals aren't able to maintain that cost many times. That's the reason they're closing down.
You brought me to Mickey. Basically, I just want him to live a normal life, and I'm hoping and I'm praying that he regains vision in his other eye, and I just hope he just be able to live a normal life. That's basically it.
Wave, AJ.